mitral valve stenosis, which is most often again caused by rheumatic fever. In this case, instead of having inflammation cause the leaflets to not form a good enough seal, the leaflets can actually fuse together, called commissural fusion. When this happens, the normal mitral valve opening, which is about 4 to 6 centimeters squared, can narrow down to 2 centimeters squared. This makes it a lot harder for blood to flow from the left atrium to the left ventricle, and so the volume of blood in the left atrium increases, leading to higher pressures in the left atrium. Higher pressures flowing through a fibrotic valve make a snap sound when it opens, which is followed by a diastolic rumble as blood is forced through the smaller opening. A constant elevation in both blood volume and pressure in the left atrium causes it to dilate and can allow blood to back up into the pulmonary circulation, causing pulmonary congestion and pulmonary edema, which can lead to symptoms like dyspnea or difficulty breathing. All this extra blood volume in the pulmonary circulation causes higher pressures in the pulmonary circulation, or pulmonary hypertension, which can ultimately make it harder for the right ventricle to pump blood to the lungs, and over time the right ventricle can hypertrophy and ultimately fail, which is called right-sided heart failure. In addition, when the left atrium dilates, the muscle walls stretch, and the pacemaker cells that run through the walls become more irritable, increasing the risk of atrial fibrillation. During atrial fibrillation, the right and left atrium don't contract properly anymore, which allows more blood to stagnate. Since the left atrium is already pretty dilated, static pools of blood can become a major risk for thrombus formation. And if a blood clot forms, it can immediately get into the systemic circulation. Finally, thinking about the heart in relation to other structures in the chest, if the atrium dilates and gets really large, it can compress its neighbor, the esophagus. And patients might have difficulty swallowing solid foods, called dysphagia. For patients with severe problems related to mitral regurgitation or stenosis, treatment involves valve repair or surgical replacement of the valve. Thanks for watching.